Next is Dr. POOJA SUBRU, free paper 72.
Good afternoon. My study is on the topic retinal pigment epithelial changes in pachychoroid disease spectrum. Pachychoroid is considered when in the presence of pachy vessel, subfoveal choroidal thickness exceeds 300 micron or an extrafoveal focus has choroidal thickness more than subfoveal choroidal thickness by 50 microns. So these are various entities: central serous chorioretinopathy, pachychoroid pigment epitheliopathy, polypoidal choroidal vasculopathy, pachychoroid neovasculopathy, peripapillary pachychoroid syndrome, and focal choroidal excavation. The aim of our study is to analyze the morphological changes in RP and choroid in patients belonging to pachychoroid disease spectrum and to analyze the response to anti-VEGF therapy after a follow-up period of 3 months. It is a retrospective study conducted over a period of 1 year. EDA OCT of 100 eyes of 73 patients were analyzed for choroidal thickness and RP changes. Response to anti-VEGF was analyzed with respect to change in subfoveal choroidal thickness and pigment epithelial detachment height. The choroidal thickness is measured under the fovea, subfoveal choroidal thickness, and below the RP abnormality. The retinal pigment epithelial changes studied are AA sign, various PEDs like flat irregular PED, thumb PED, notch PED, fibrovascular PED, hemorrhagic PED. In our study, CSR was found to be the most common variant, followed by PCV and PPE in about 1/4 of study subjects. The choroidal thickness under the RP abnormality is found to be more than the subfoveal choroidal thickness. Therefore, the choroidal thickness under the RP is more reflective of the disease activity. Serous PD is the most common RP change seen in acute cases of CSR, whereas RP atrophy is seen in chronic cases of CSR. In pachychoroid pigment epitheliopathy, common RP changes are AA sign and flat irregular PED. Here, RP reacts to the underlying choroidal changes without any SRF, subretinal fluid. AA sign was invariably seen in all cases of pachychoroid neovasculopathy associated with flat irregular PED and fibrovascular PED. Polypoidal choroidal vasculopathy is associated with characteristic PED like hemorrhagic PED, thumb PED, and notch PED. Peripapillary pachychoroid syndrome. Here the choroidal thickness is maximum between the optic disc and fovea associated with subretinal fluid and AA sign. This is a graph showing response to anti-VEGF among PCV and PNV patients. The subfoveal choroidal thickness as well as the PED height decreased significantly in the PCV group as compared to PNV, which is indicated by the slope of the graph. Among the intravitreal injection given, aflibercept was found to be better agent, bringing about significant reduction in the parameters assessed. PP is a atrophic variant where there is no subretinal fluid, whereas CSR is the exudative variant associated with subretinal fluid. Both PNV and PCV are neovascular variants where PCV is associated with characteristic PEDs as mentioned. PCV patients showed better response than PNV. That is probably because PCV group is more neovascular disease with exudative component and with high level of vascular endothelial growth factor expression. Therefore, they may respond more to anti-VEGF. In our study, the mean subfoveal choroidal thickness as well as the PED reduced significantly with aflibercept, whereas ranibizumab showed significant reduction in the subfoveal choroidal thickness only. So, aflibercept is a better agent in bringing about polyp regression. The study conducted by Saito et al. Showed that there was no significant reduction in the subfoveal choroidal thickness with ranibizumab, whereas there was significant reduction in the choroidal thickness with aflibercept at the end of first and 6 months. Study conducted by Hanju et al. Showed that there was significant reduction in choroidal thickness with aflibercept and ranibizumab, but there was no difference among the two injections. To conclude, pachychoroid is a common clinical entity that we see in our day-to-day practice. Identifying the characteristic RP changes is important to diagnose, to plan treatment strategy, and to assess the response to treatment. And regarding the treatment options, intravitreal injection aflibercept is more effective in decreasing the PED height, thereby bringing out polyp regression. So these are my references. Thank you.
What is What's the usual presentation of pachychoroidal spectrum?
Blurring, blurring of vision will be there.
Do you pick it up by accidentally, or is there any major visual disturbance?
Most cases there may not be major visual disturbances. Many of them are accidentally discovered, but some cases there will be much reduction in the visual acuity.
Okay.
Thanks.